So, welcome to the South Asian Public Health Association Spotlight Series, where we illuminate the remarkable individuals shaping public health, especially within the South Asian community. And we are your hosts. I am Malini, the treasurer of the South Asian Public Health Association, also known as SAPHA.
And I'm Rabana. I am the co-chair of Advocacy Committee. SAPHA is committed to advancing the health and well-being of South Asians in the US and beyond, fostering collaboration, advocacy, and research to address health disparities and promote equitable outcomes. Our podcast series dives into captivating conversations with influential figures in public health. Stay tuned for inspiring stories, insightful discussions, and a closer look at the impactful work of SAPHA over the past 25 years. Learn more about us and explore the wealth of resources we offer at www.sapha.org.
Today, in our fourth episode celebrating SAPHA's 25th anniversary, we are honored to welcome Sharmila Rao Thakkar, an accomplished nonprofit and philanthropic advisor specializing in leadership development, program implementation, and resource development. With a background in health communications and public health, she has transitioned into a multifaceted role focused on fostering equity, social impact, and leadership within communities. Sharmila's dedication to public health and social impact is underscored by her leadership in crisis preparedness, community engagement, and collaborative partnerships, making her a respected thought leader in the nonprofit sector. Sharmila is also one of the co-founders and founding members of SAPHA, where her contributions to SAPHA have been invaluable. Sharmila, welcome to the SAPHA Spotlight series, and we are so excited to have you here with us today.
Oh my goodness. Thank you so much for that kind introduction. I'm honored. It's my pleasure. And I'm really delighted to be here with both of you.
So we'd like to start off with a deep dive into your story. Can you share a brief overview of your journey in health communications and public health, from your academic pursuits to your current roles in the nonprofit and philanthropy sector?
Sure. Wow. So SAPHA is almost as old as my career in the sector. So this could take a while. No, I'm done joking. Like many South Asians, I went to college thinking that I would be going to medical school. I wanted to be a physician like my parents. My father was a surgeon and my mother was, well, she's retired now, a pediatrician working in community health clinics in New York City. I think it was my sophomore year when I realized that med school and the road to becoming a doctor was a long one. Sitting in chemistry, I realized that I really wanted to be close to the people, doing the work on the ground in the community quickly and more deeply. I didn't want to be sort of siloed into one arena. And so that's when I really started thinking about health beyond medicine. I don't know if I knew the word public health at the time because the school I went to didn't have a public health department or division. They do now. And I remember seeking out professors that taught on issues that I cared about, like women's health, gender equity, international policy that impacted healthcare. And I decided to study international relations. I always had a deep interest in the South Asian community, both here and abroad. My dream was to actually live and work in India after I graduated from college, and for reasons that I can get into later, that did not happen. And so I crafted my own major within international relations to focus on public health and public policy, comparing South Asia to South America and Africa. And I was lucky enough to find professors through their departments that had a focus on some of the issues that I cared about. And I remember patching together anthropology, sociology, econ, and poli-sci to sort of teach myself, but with my professors, about the issues that were impacting communities across the world. When I graduated, I had always, we grew up, it's very different now, but we grew up with a lot of messaging on TV mostly. Now I know there are lots of other avenues that youth learn and about issues. But, those were the days when you would see commercials for alcohol and cigarettes and things like that, right? And it always made me wonder how we share stories and how we message to our communities, and especially to young people. And so so I was always interested in communications. I worked at the radio station during college. I wrote a lot, was interested in newspapers. And after college, I worked for a few South Asian publications where I would, report on events happening in New York. And I was really fascinated by the power of our voice. And so one of my first paid jobs was actually in public relations in healthcare. I had done a short stint through internships in high school and college. And my first role showed me the power that corporate healthcare had. So pharmaceutical companies, big, large medical institutions, research, how money flowed. And I worked on the side of translating medical research and medical knowledge for laymen, so the public, because we were hired as the team to study what was coming out from these institutions and put it in a way that the public would understand. And so some of the disease areas I worked on might not have been, again, areas that I knew anything about, but that was what I was tasked with. And so that job really pushed me more to understand public health, even though I was working in corporate and it was very much about medical education from a different perspective. I realized that I wanted to be involved in learning to share messages with the public on how to implement, for example, behavior change or programs in communities that could really make a difference. And so that was after 3 or 4 years, I decided to study public health, and I went back and got my degree, my master's in public health, as well as a master's in public administration and policy, again, because I was always interested in wider, deeper community change. And that's actually where I met really amazing people. And I was privileged, honestly, to work with them to found SAPHA. From that experience, I had I think for me, I feel very lucky that I was able to have a fellowship at a foundation, a large foundation in the division that dealt with women's health and reproductive rights in an international sense. So that was what I had studied in undergrad. I had a focus on it a little bit in graduate school, and it showed me the power of philanthropy, investing in leadership across the world, investing in nonprofits that were serving communities. And, it's not easy to get a job in philanthropy. So when I left New York and moved to Chicago, I actually went back into public health on the nonprofit side, doing healthcare communications, public relations, marketing, and messaging. I worked with the American Medical Association, the Hospital Association, and Illinois Poison Center. I'm coming out of the Ford Foundation, where I was doing more global work on women's health, and the International Women's Health Coalition as well, where we were doing messaging around women's health and reproductive rights. This took me back into a domestic, very local sort of environment. And for me, at the time, again, dreams shattered at the moment from studying internationally, but I realized that, my backyard is here. And so I shifted my attention to really understand the communities that I lived in and worked in. I became a parent during this time. And so having those jobs really helped me understand, again, the importance of science and research, communications and marketing, and being able to tell a story so that the communities that we work with, the general public, understands what's happening sort of at this level, so that we could make the change that we want at this level. And I think for me, I love learning, and so being in environments where I'm constantly exposed to new information and figuring out how to be part of the change that we seek in the world was always what sort of drove me. That was always my passion. And so, yeah, that shares a little bit about how I got to public health. I think these last 10, 15 years, I really got back into philanthropy on the giving side versus on the side where we were doing programmatic work. And I was, parts of teams where we were the recipients of funding, whether it be private philanthropy, government funding, or otherwise. I was very, I missed really being involved in an environment where we could seed change with dollars.
Mm.
And I started just looking for those kinds of opportunities and consider myself, like I said, lucky that I landed in a family foundation that had a medical research, a social services, health, and education and environment set of portfolios. Being a generalist, it was exactly the type of giving that I thought I could bring my content area expertise to. And so for about 10 years, I worked in this family foundation where I helped the family decide where to give their dollars, mostly in Chicago, but at the time there was some international giving as well, of course, in healthcare, because that was, again, one of the primary giving areas. And I really treasure that time because not only was I able to bring the strategic focus to give back to communities doing good work, I brought, coming from the nonprofit sector, coming from public health, the ability to build capacity and be a partner to nonprofits. So whether it was doing training sessions or sitting on their boards or committees, the foundation really believed in going beyond the grant, beyond the dollar, to provide technical assistance and capacity building. And that was what made that role that I had so fulfilling, is that I was at this unique place between philanthropy and nonprofit, but obviously working on content areas, my background being in public health, seeing sort of the connections between all of that. I left Chicago, so I had to leave what I consider one of my dream jobs to move back to New York. And I have started a consulting practice where I serve as a philanthropic advisor to donors mostly, but I also work with nonprofits that work in the social service, social impact. Many happen to work in public health as well, or climate justice, which later on we'll talk about how I think all of this is related to public health and well-being. And I now, have a nice portfolio of philanthropists and donors, foundations, and nonprofits where I get to advise on issues that they care about, everything from medical research to reproductive rights and justice, to climate change, to youth engagement and leadership development. So that's how I got here.
That's an
Thank you so much
amazing.
thank you so much for taking the time to share that beautiful story. I think, definitely sitting in chemistry resonated with me. So for me, I think it was organic chemistry for sure. So just moving on to the next, question for you. How did you become involved in SAPHA, and, what inspired you to co-found this organization dedicated to, South Asian public health?
So I think all of those of us that you will be interviewing, I think, will be sharing how they had to rack their brains and memories. And for me, it was my AOL account that no longer exists, where I, have all my SAPHA emails, to recall sort of those early days. I didn't get to go too deep into the box that I have in my storage, or like way into my emails from 25 years ago. But I do recall that as a professional, and as a graduate student at the time, I remember being surrounded by South Asians working in the nonprofit sector, in academia, in social services, in healthcare, in medicine, working on gender-based violence, medical education, pharmaceutical, marketing, sales, and research, and just thinking, wow, there's so many of us tackling health from all these different angles. And public health was the one thing that brought us all together. I mean, I can't tell you, when I was studying at my master's, and I know I was in New York, and, obviously our co-founders were in other cities, there were so many of us from the South Asian community, again, addressing issues of relevance to our communities from different standpoints. Not only avenues like research or marketing or communications or medicine, clinical, but also different issues. And so it was the seed of an idea that I think we were craving: community, collaboration, continued learning. I mean, I don't think I took a class focused on the health of my community. So by coming together with others that cared about these issues that I saw relatives, friends, just people in my own backyard dealing with, and needing a place to go to talk about these, to figure out solutions, that's really why I think we wanted to come together. There was at that time, we were hearing a lot about other communities that were advocating for research in their communities, that was informed by their communities, not, sort of putting us, at sort of like the third person, but really leading. We needed to be the voice ourselves. We needed to make sure that the leadership was representative, that the studies that were being done, and furthermore, the dollars that were flowing were going to this research, going to our communities. And for me, sitting in a class in my public policy or public health program, you're being talked to, you're being told that these things are happening out there. And when I found other people that wanted to be part of the solution, it was really empowering. And I think we were very lucky that I think there were maybe 8-10 of us in the beginning. I mean, it was a couple, you heard from some of the previous podcasts, it was a few people, and then we kept talking to others. At that time, there were organizations that existed for other South Asian careers or focus areas, like the South Asian Journalists Association or the Bar Association, or, I was very active as a child and a teen in API, the American Association of Physicians from India, because my parents were engaged or involved. But there was nothing for public health, which in my view brought so much together that our community was facing. And so, yeah, I mean, just looking around and saying, wow, even those in social work, right, have a health focus, have doing good for, by, and with our communities as the focus. And so it just made sense to create this organization. I mean, I think if I recall, it took us a little while to get our status, to fundraise. So I know that you're still volunteer-led and volunteer-driven. It was sort of in our DNA that this is what community organizing is about. I mean, many of us had, again, parents, family members that showed us how to do this. And it was, that was the inspiration, was wanting to kind of come together and seed this change that we thought was possible. And can I say this one more thing? We didn't have, literally email started when I was graduating. So we didn't have ways to come together, right? Like when I say AOL, that clearly dates me, but I remember this was the first time that we really could build across the country, right? Because we could get on conference calls, we could use email, and to see the power in our numbers was really sort of, again, it just moved. It was moving. It was like, we have to do something. There are pockets of us that care about these issues. And if we don't come together and create a place for those ideas, the research, the potential solutions, then we're not going to see the change that we want to see.
That's amazing. And we are so thankful that, the founding members, I can imagine how hard it must have been to start something like SAPHA from scratch, but we are so grateful that the founding members put in so much of effort to do this. So being a founding board member of SAPHA and being so deeply involved, in all its activities and getting it started, both through communication as the writer and editor for the brown paper, we can see it's no small feat. So how has your experience with SAPHA influenced your career trajectory and your personal growth in the field of public health?
I mean, this is an excellent question. I mean, I sometimes, forget how much we did or, seeded back then, because I look at the organization now and it is incredible what you all have continued to build and create and nurture. SAPHA was, I had always been involved in the nonprofit sector. I think giving back, volunteering, service, trying to address issues that our communities were facing was always something that I felt passionately about. Whether it be in high school or college, post-college, I was, involved with some nonprofits in New York that served our community, but never really, I think this was the first organization that I can say I was a co-founder of. And, it was no easy feat fundraising, getting people together, deciding what our mission was going to be and our focus areas were going to be. And all of that has helped shape the career choices I've made along the way. learning how to work with people across time zones in different states, learning how to work with people of different backgrounds and disciplines that might be speaking a different language because they're in the lab and I'm out in the community, or, they're a physician and I'm, a public health outreach worker at points in my life, or that I'm a writer, but they're a researcher, or someone's a fundraiser or, or a donor. SAPHA sort of gave me the confidence through that learning that I could do the things I've done in my career since then. I mean, when you're in a small nonprofit or you're a founding board member, you kind of have to wear lots of different hats. And whether you yourself are doing the work or figuring out how to do the work, researching, I don't think we even had Google back then. You are interviewing colleagues or asking friends or fellow board members, hey, do you have any ideas on how to do this? I mean, our way of learning looked a lot different than it does today. Like, we didn't have ChatGPT, right? So for me, that journey to figuring out how to build something, to ask the right questions, to be okay with difference and new ideas, to take a risk. I mean, really, SAPHA, I was a Girl Scout. I at some point, it was a leader for my daughter's Girl Scout troop. So they have these courage, confidence, and character are three of these guiding principles. And I look back at my time on SAPHA, and I really believe that the challenges we experienced, the opportunities we were given, the sort of big ideas we have helped me really build courage, confidence, and character to switch careers, to do different things, to say, hey, yeah, I used to do marketing and communications for a corporation and work with, pharmaceutical companies as clients. Well, how does that fit into public health? Well, it does. It gave me sort of the language to tell a story and to transfer skills from what I had done to what I was learning to what I would want to do. I mean, again, I think many people that have started a nonprofit or a program at a nonprofit can share a similar story. But for me, SAPHA was empowering, even through that building phase, to say, oh my gosh, yeah, we have the seed of an idea, and then look back and say, hey, all of us brought various skills and talents to the table to do this together. That collective energy, that collaborative sort of power is what I learned is possible from SAPHA and the group that we were lucky enough to pull together.
I'm so glad to hear that, not only were you able to give so much to SAPHA, but SAPHA was able to give you a lot as well. I'm glad to hear that. So mentors, play a crucial role in shaping our careers. I definitely wouldn't be here without some of my mentors. So tell us a little bit about your mentors and who have influenced your career and the lessons you've learned from them. Additionally, what advice do you have for emerging public health professionals on seeking mentor?
This is a good question, and I think also a tough question. I recently saw a colleague answer this question, and the way the question is phrased, it makes us think, or I do a lot of leadership development for next gen, for college students, for those graduating, those that are transitioning in their careers. Coaching is a part of my advisory practice now. So I end up coaching a lot of nonprofit leaders or philanthropic leaders. And the assumption is that we must have a mentor. Mm-hmm. And this concept was turned on its head for me recently when a colleague said, I don't know if I had any. I had to build, find, create, seek out my own learning and growth and development. And maybe that was for a period of their time, a period of time in their career. I did not have that experience. I feel that I very much benefited from mentors in my life. One thing I'll say, and it sort of gets at a question you asked to answer towards the end, is that I don't know at the time that I would have said they were my mentors. Mm-hmm. I've since learned that if you want someone to be a mentor or a sponsor, which is another related word that we tend to use in the sector now, that we should identify to that person that we want them to serve in this role for us. I think sometimes it is synonymous with having someone write you a reference or a recommendation, a mentor. But there's some nuances to what a mentor provides that I think having the conversation with them or calling them out on what kind of support and guidance they've provided you is really important. So for me, aside from, and I know it's so cliche to say my mom, but yeah, while she was a physician that immigrated here, she tells the story of how she delivered healthcare in her village early in her training days. And most of my life, she worked in public health. She worked at a women's health clinic where her, patients were women from certain communities that did not have access to healthcare. They were teenagers that would enter her clinic, and she was everything to them: medical care, clinical, public health messaging, a guidance counselor, a supportive shoulder to cry on, research, back then, again, may not have been a computer terminal. So for me, she was one of my first mentors that told me, you know what, you don't have to take chemistry. There are other ways that you can pursue your love, your care for community, your passion for health. So I credit her with that first message, because she made it okay for me to think outside the box and really know what public health could be. And then there were two other people. One was a woman whose expertise was adolescent health when I worked at the American Medical Association. And she really allowed me to pursue the gamut of public health issues when I was early in my role there, would sort of throw it all at me and allow me to understand everything from older adult care and issues to teenage, adolescent public health issues, to taking deep dives on particular areas of interest for different communities, ethnic communities. And so she made me also realize that work is hard in large institutions, that there's lots of red tape and there's hierarchy, whether they tell you that when you interview or not, but that with the right people on your side, or surrounding yourself by some really good people that, again, can be mentors and be guiding lights and supporters, that you can still do the good work that you want to do through the difficulties. And so, yeah, I had some tough times, but she really showed me how to get through that and to find your people. I think that's the time in my life where I realized that finding your people is really important, whether it's at work, outside of work, and extracurricular activities. And then I would say, there was someone else that I worked with for about 10 years. She's the one that took a risk on me when I moved from the nonprofit health sector to philanthropy in the Family Foundation. And to this day, she remains one of my closest colleagues, friends, mentors that invested in, and this is the thing, mentors to me invest in your leadership development, your continuous learning. They challenge you. They provide you with opportunities to learn and grow. They give you advice, but they also let you make mistakes. And they provide that comfort zone where you can explore what didn't go as planned. And so for me, mentors are, again, not easy to find because it takes time to be someone's mentor. And I think that the number one thing that I think that I've done to identify good mentors is first do my own analysis or evaluation of what my values are. Because you ideally, the mentor doesn't have to have the same values as you do, or even work in the same area that you do, but you should be clear on what you're looking to get out of a relationship like that. And so, I think I'm privileged now to be in a position where I get to mentor others. And I've always been impressed by how young people come prepared with their questions, with their ideas. And honestly, back earlier in my career, again, like I said, I may not have thought of that person as a mentor, or that I was prepared going into that relationship thinking I was a mentee. And I've learned a lot since then about how to develop or cultivate a good mentor-mentee or sponsor relationship. So in terms of like advice, I would just say we have to be ready to ask, to be told no, but we have to have our, as they say, elevator pitch or sort of, explanation or reason for why you're approaching this person. And I love how you said earlier, are they getting something out of it as well as you? These relationships should be mutually beneficial. And then that's why I continue to mentor and continue to have mentors, is because we're in partnership and relationship with each other.
It does. I think it really talks about how dynamic the mentor-mentee relationship is, right? Especially when it's not just the mentor giving and the mentee taking. It's a two-way street, right?
Yes, true. Very true.
If you had to look back, what is the most significant lesson you've learned in your career? And if you could go back 25 years, what advice would you give yourself as you were trying to build your career?
I have benefited from deep, intimate, intentional relationships. I don't know that I, was ever told that by anyone, like the power and potential of the relationships and the people we surround ourselves by, but I witnessed it in our community, right? My parents were immigrants. They would have never been able to get where they are without the power, the generosity, the caring of the people in their community, without asking for help. Saying that we need help is so hard for many of us. And so even though I've done these things or realized the benefit of these things over the years, I wish that I knew then the value of that, asking, making mistakes, realizing, that the community and the networks that we have are our greatest assets. I wish I knew then that that was the case and that I had to initiate developing that connection or that community. It happened organically, and maybe it's just that we now have language for these things that have always been part of our history. Certainly in the South Asian community, we know that our strength is built in the collective, in the community, in the collaborative. And so, I think that I now know, and it's one of the sort of quotes that I, sort of always use, is that change moves at the speed of trust. And that trust comes from strong, meaningful relationships. What's underneath that? Values, understanding, caring, compassion, right? These things are always there. I think I'm a parent now, and so I now teach my children, because these, we cannot be successful in the world or solve the challenges that SAPHA and other groups like SAPHA are trying to solve without our communities and without our networks, without continuous learning. And I think that's the other sort of lesson that I've learned. Learning is a journey. It does not stop and start at a point in time. And now when I mentor, students or people new in their career or transitioning in their career, there is this concept that, right, we are on a lifelong journey to learn. And so when I take on jobs or projects, I am learning just as much as the people that I'm working with are learning from my engagement with them. And so again, I think that if somebody had told me you're just getting started and this journey of learning is forever, I think I wouldn't have been in such a rush. I think I wouldn't have tried to do it all in those first 5 years of SAPHA, right? Like when you're working 24/7, you're pulling all-nighters, you're not having balance in your life. And I think one of my colleagues, co-founders, said something, talked a little bit about this. I think I would really slow down a little bit I think I would have more patience with myself and with those around me. I think I would realize how important storytelling is. I know SAPHA does a really good job at, and clearly this podcast series is part of that, making space for people to share their journeys, their challenges. I think I would be better at accepting my mistakes. You know, when we founded SAPHA, everything didn't go perfectly the first time around, right? It was a learning journey. And I don't know if it's like, I don't know where that message comes from that you got to get it right on the first time, right? Like we're surrounded by entrepreneurs and technology that failure is actually the biggest way we learn. You know, we're not going to take risks if we think we're going to fail, right? So if we flipped the switch and someone had told me that it was okay to not get it right the first time, I think I would, you know, maybe do things differently. This idea that, you know, I think I grew up with a fixed mindset versus a growth mindset. So for me, I can now look back and say, you know, the experiences in my life, SAPHA included, taught me that a growth mindset is critical if we want to be on a journey of lifelong learning and change making. You know, the last thing I'll say, and it's really something I learned and was able to articulate through my COVID pandemic response work, crisis work, is don't let perfect be the enemy of the good. It has been sort of a resounding tenet for me in the last several years. And so again, I think that advice is something I would certainly give myself 25 years ago. But I also think for those entering public health, working on equity, gender justice, social impact, we have to approach it from a lens of continuous learning, patience, trust, and that we can fail to get to that point of success that we're seeking. It's part of the journey.
Thank you so much for reminding us that, you know, we will fail, and that compassion not only goes for other folks in our community, it also goes towards us as well. So, you know, you reflected a little bit about your time with SAPHA. You mentioned there was lots of all-nighters, you were rushing a lot, but, you know, I'm curious to know what was the most enjoyable moment during your first few years with SAPHA?
Oh, I love this question. I look back on the time that we worked on the brown paper as one of my fondest memories. You know, just so proud to see that book. You know, when I remember distinctly receiving the 2 boxes in my apartment in Chicago and opening it and just feeling this sense of, wow, not that what we had accomplished, but that I was going to get with my fellow board members and volunteers that information into the hands of so many people, not just in our own community, but funders and researchers and the government that needed to know that there were people working on this. It kind of shed the spot. It was a way that we could shed the spotlight on the needs of our community, the work that was happening and the work yet to be done. So for me, editing, you know, writing the women's health chapter way back when, interviewing people, unearthing like all these amazing public health professionals and researchers and clinicians in the field doing this work and bringing them together to that chapter, but also, you know, being a co-editor for the entire book. I love writing and I love editing. And so that was sort of like an ideal place for me to, you know, exhibit some of my passions with SAPHA at the time. And I also think something that stands out for me is fundraising. I think I got one of our, again, you all have done such amazing work since then, but I remember getting maybe a $6,000 or $10,000, between a $6,000 and $10,000 grant, maybe over a couple of years from the Office of Women's Health, DHS, for some work that I was doing in Chicago under SAPHA's umbrella. And it was just so amazing, again, to see that what we were doing, we were bringing together South Asian women for a conference, a full day long conference, again, under the SAPHA umbrella, and to get funding from a government agency for, again, something that at that point seemed so niche was, again, it was just incredibly gratifying and empowering, right? It like put this work we were doing on the map. You know, seeing my colleagues be invited places with the brown paper to talk about it, like including APHA. I mean, I'll say that's another shining moment and memory that I recall fondly, is having SAPHA get together at those APHA, those early days at APHA conferences. I think we named it Chit Chat over Chai and Chat or something like that, you know, back then, like really early, and seeing that what we could do when we come together in a national forum, but also we had chapter rep, we didn't have a chapter structure, but we had people in different cities, New York, DC, Bay Area, Chicago, and seeing that we could bring together people locally in our own communities and then nationally, just again, being in a room of 50 to 100 and now plus that. And I'll never forget too, the first time seeing members of our community, of this community, having poster sessions, you know, and being on panel discussions and seeing SAPHA in their bio or them mentioning SAPHA in that forum. Just, you know, again, amazing to see that this little seed of an idea is in places where it counts and matters and is needed.
I'm so glad you mentioned that, because Chai and Chat is still my most favorite event of SAPHA. It's really great, like especially when you're working, you know, we are all spread out, right? And then when you come together and you see, wow, this is what SAPHA is about. It's amazing. So over the past 25 years, SAPHA has achieved significant milestones, right? Many of which you were either directly involved in or helped set the foundation for. So this includes obtaining the 501c3 status, you know, publishing the influential brown paper, receiving prestigious awards, forming critical partnerships, advocating for health equity, actively addressing evolving health needs within the South Asian community. Now the impact of SAPHA extends to legislative advocacy, such as the South Asian Heart Health Awareness and Research Act, participation in national health campaigns, establishing a noteworthy presence in Washington, D.C., marked by engagements with the Secretary of Health, invitations to the White House, active participation in key conferences, and continuous efforts to address health disparity and promote equity in the South Asian communities. So given all of this, where do you think SAPHA can be most impactful in the next 25 years?
Wow. Just kudos and congratulations. I mean, again, I watch a little bit from a distance, you know, your social media pages and your newsletters. I have to say, I could have never imagined. I mean, that was the dream, right? To be involved in policy and advocacy, in systemic change, in addressing root causes. And you all are doing that now. I can't imagine what the next 25 years will look like. I mean, clearly, there is more to be done. We all know that, right? But this association, your membership is in all the right places to keep that conversation front and center for our community. Some of the things that I think, but again, you know, I'm not an active member, in full disclosure, right? So these are things you're probably already doing, but these are things that I continue to see as needs from the work that I do, which I feel is a little peripheral, right? Like I get to work with donors that say, hey, Sharmila, and I should say too, like my personal passion area is working with South Asian donors, and many of them care about public health issues like mental health, like heart health. You know, these are two of the primary areas, like gender-based violence and reproductive justice. I mean, these are some of the areas that I get to work on now. And so when I say peripheral, it's like I'm still looking to see what's happening there so I can match some of the philanthropic resources with the amazing work that folks like you and your colleagues are doing in the field. And so one of the things that I think is still necessary is that networking component, right? Like, how do we build awareness, understanding, communication, so that people maybe outside of this, you know, realm are aware of the ways that they can support the work, be part of the work, move the work. I know that there's been work to create one-stop shop directories of research and things like that. And I love that. I mean, again, was a dream, right? And so similarly, when I get a request that says, I want to fund a South Asian heart health study, because that's a passion area of mine. I know a couple of I know the handful of studies happening around the country, so I can reach out to them and make connections, right? But there are lots of these kinds of things. Like someone recently came to me and said, is anyone studying mental health in the community? And again, because I'm part of the listserv, I can like search that, right? But I wonder, is there a way to build, more of these resources so that when those that are looking, whether it's for the scientific, clinical, research, whatever side, or the side to invest in, I that's kind of where one of the things I'm thinking about is how do we market, promote, communicate, build understanding, and then create the networking opportunities for people to understand where they can access the resource on one end, or be engaged in the work on the other. Because I'm seeing a lot of this work from the donor side, and I don't know if this is one of the questions we'll get to address, but this generation's donor is very different from the previous generation, right? They're not just writing checks. They want to be engaged in the work. They don't want to just hear a report about how something went. They want to know if they can be part of the study or help sit on an advisory board, even if they're not maybe directly involved in clinical or research or public health work, that they have experience they want to bring. And so, I wonder, how SAPHA can be part of these other conversations or help build those bridges to connect people that are interested in learning more, being part of this work that members are doing. I know that you've done a lot on advocating for disaggregated data. I mean, I know many of your members have been at tables where this is happening and now possible. So I think continuing to share why that's important for lay people is also really important, because I find sometimes I'm sitting at tables still where I need the language or the resources to share with either those in the community or donors that I work with. Professional development and job searching, career development. I think early in my career went to SAPHA for that. My colleagues on the board and those early days, they were the best resource for me on learning where there was opportunity. If I wanted to do work in this field, they were my best resources on how and where to find those opportunities. And so I think new people coming out of public health school, or even physicians that want to, think about these issues from a public health perspective, how can we sort of grow the ability of this organization and our community to learn from each other and access those resources and those opportunities. And lastly, I know that you're chair of advocacy, and I know your communications, are so much more just professional and expansive than I could have ever imagined, even though I was really involved in communications when I was on the board. I think continuing to focus on marketing, communications, and outreach is really important. I mean, I know that there's a handful of issues that everyone thinks of when they think of the South Asian community, but there are other issues that are emerging, that are pending. And so I think of the role that communications and marketing can play as in getting the word out and bringing people together to start thinking about those. For example, a lot of again, my experience only, but family, friends, colleagues of South Asian background that may not be in the healthcare space, they start thinking about health issues when they become a parent, or when they become a caregiver, or when they are transitioning in their life for some reason, when they're making a career change. And so I keep thinking about, I put SAPHA on the list the other day for someone that was looking for speakers for women's health issues in the community. And I would love to see more of SAPHA's membership and leadership in maybe, places where we might not think of, right? So that's, again, branching, building, connecting, collaborating. And again, you're doing a lot of this. I think for me, I'm just wanting to impress upon SAPHA how important that is. because there's a lot of lack of awareness and lack of understanding, and you bring that perspective.
Thank you so much for those great suggestions. And, it's, when you're doing the work, you're in the grind, you often forget, what the future could look like, what the next, steps could look like. So thank you so much for those suggestions. You mentioned heart health and mental health being one of the two topics that comes up a lot in your current position. In your opinion, what do you think are the most pressing public health issues faced by the South Asian community, and how can organizations like SAPHA address them effectively?
Great question. The first thing I thought of is access to healthcare and access to information about health and well-being. Since my earliest years, probably in college, I think of health as, the most global definition, right? Like the full state of complete physical, mental, social well-being, the WHO definition, right? That it's not only the absence of disease, but it is the sort of living a full, well, healthy life. And to me, so many issues impact that ability. And access, again, to information and healthcare is critical to, I think, what I'm seeing people in our community, they just don't know what they should have access to, could have access to, need access to. I have personal family experience with heart health, cardiac issues. And so for me, that remains front and center in my work and in my personal life as well. Have seen how, there's a growing need for young people to have access to mental health services. And there remains a taboo in our community around mental health. Another area that remains, I think, to have some taboo around it is gender issues broadly, but talking about gender-based violence, it comes in many, many forms. And I think when we talk about gender equity and we talk about sort of the gamut of healthcare issues that affect women and girl identifying through their lifespan, it's something that keeps coming up to me. And again, I'm now a parent, so I see both my son and my daughter asking me really thoughtful questions. And I think that we can play a role in helping our community members access information, ask for what they need, and trying to help build advocates, self-advocates in my children. When they go to the doctor, I make sure they are ready to rattle off the medications they take for the illnesses or the conditions that they're dealing with. I want time for them to be with their medical providers without me, because I want them to learn how to ask the questions. I mean, it's a little tough because you can Google everything these days or chat GPT it, but I still think that there are communities that we are not reaching, that we can be reaching, so that we can lessen the barriers, remove the taboo that some of these public health concerns some of these public health concerns that are still impacting our community. The last thing I'll add here that I again am dealing with and seeing more of my peers dealing with is older adult care and preparing for end of life. Again, taboo topic, because I work, one part of my work is working with wealthy people that are preparing for, what comes next for their future generations, but also themselves. This is on their agenda. They are planning for this, but this should be something we are all thinking about so we can live the way that we want to live at all stages of our life. And so, yeah, I think of that as public health, again, because it has to do with well-being and health, again. Community could, like, maybe SAPHA has a role in helping our community understand better the life stages and all the various aspects of what healthy individual, healthy family, healthy community healthy life really means.
I mean, thank you for that insight. And I think, it is in line with what I guess SAPHA's thinking about, because I think there are areas that have, traditionally been taboo topics that we're trying to, at least the younger generation of South Asian researchers are trying to get into. So it is in line with, I guess, what SAPHA is thinking about. And I'm glad we have that in common with the founders. So, Sharmila, thinking about leadership development and how it's a key aspect of your work, how do you believe fostering leadership within communities can contribute to better public health outcome, particularly in underrepresented and marginalized groups?
So, I think many people learn by seeing. More people probably learn by doing, right? I talked a little bit earlier around how I see the next generation wanting to be part of the change they seek. They are not going to sort of watch from over here. They want to be at the table, in the community, in the work, helping solve the problem. And so we really need to build the knowledge and awareness, the understanding in our communities, but we also need to build the capacity of this next generation to engage in the change, to have a voice. I don't know if, this is not SAPHA's role or sole responsibility. I mean, we see how high schools and colleges and universities are approaching, learning, and how young people are sort of seeing themselves. I mean, I just think that if we don't give sort of the next generation the tools and the sort of opportunity to try and test, to take risks, then we won't have the solutions, right, that we need. And I think that traditionally medicine, science takes a really long time, right? To find a cure, to invent a procedure, create, invent, and get approved a procedure, vaccine, like all of these things have taken, I mean, although COVID showed us, how quickly things can happen, right? We need to allow our next generation this space to experiment, to voice, to test and try without judging, right? Like, this is where I think philanthropy can really sort of have a role, because that is the one place where we might have resources to take some of these risks, to really create a pipeline for these leaders, the next generation, to come in with their bold ideas and bring others to the table. They're not alone. I mean, back in the day, there might just be one person, right, that wanted to do this thing, and it would take them a long time to get support. But we know that there's power and strength in numbers. And we know just by the way that we now can communicate with each other and find each other and unearth these amazing ideas, that we need to create spaces where that energy and those ideas can come together, to either be seeded, generated, built upon each other. I also want to say here, I think this is where, for me, equity comes into play. I think that we have learned in our own community, right, that if you're not at the table, you might be on the menu. Like, there's that phrase, I'm probably messing it up. And so I think when we are nurturing our next generation, we have to invite them into the space, but actually those of us that are sort of been here for a while, we need to not only create space and extend that invitation. It might be moving out of the way. There's a sort of, obviously, lending our hand down and helping pull next gen leaders and future leaders up the ladder with us. But I think at some point, and, because I enjoy doing multi-generational work, I'm often at a table, helping or coaching multi-generational leaders how to work together. But I do think in all the transitions that I've also been honored to lead, there's a time when we need to, maybe step away and make space. And so again, these are some of the ways that I think we can foster leadership, cultivate leadership, and make space for that leadership to truly lead.
We want to talk about is, you kind of mentioned, the word trust when it comes to public health. You talked about your experiences during the pandemic, but, the public health world has, faced significant challenges over the past few years. And I am, sure you have felt the brunt of doing your work day to day in the nonprofit sector. How do you, continue to stay motivated despite these challenges?
That's a tough question, because I can for sure tell you, and I had someone recently tell me that I'm really good at sharing my weaknesses or my challenges. So take this with a grain of salt. The only way that I feel that I've been able to overcome challenges, and I'm being very personal because I've learned from others in my life, mentors, family members, colleagues, that if we don't pause to acknowledge where we've faltered, we really won't be able to learn and grow so that we can achieve success in the future. And COVID really taught me that. I, again, didn't plan it, but I ended up, as executive director of a local nonprofit coalition that was called to respond to COVID in New York, and was really, honored to be able to work with the New York City Department of Health and crisis coalitions here, from hospitals to public health groups to first responders, on that pandemic response effort. And we made a lot of mistakes, but we also had a lot of successes. And what defined the successes was that everybody had a common purpose and a common goal. And so even though people sat on different aisles politically, socially, culturally, of this major devastation that we were facing, right? Loss of life, access to healthcare, disparities. I mean, if we ever doubted it, that pandemic showed us the reality of the disparity that exists in our disparities that exist in our community and in our healthcare system. But what brought people together was this one goal. So whenever I would have meetings, right, we would remind ourselves why we were here. If it was to ensure access to masks and face shields, ventilators, or the vaccine when we finally, had access to the vaccine, or whether it was to prevent the loss of life, or whether it was to change behaviors so that we could keep our numbers down in my town, there was a goal that we collectively were coming around. And so that is what motivates me, right? It is reminding ourselves why we're in the work, and ensuring whatever group I am gathering, that objective is clear. You're not going to always have people at the table that share the objective. And to that I say, and I do a lot of this conflict resolution and mediation work in my family philanthropy work, they have a choice. They can stay at the table and contribute, because I believe regardless of where they're sitting, that they will have some good ideas to contribute. Sometimes the best ideas come from people that don't think the same that you do. Or they can leave the table, right? I mean, we can't satisfy all people all of the time. And so in that COVID work, when we focused on the goal, the objective, I found that we were able to bring people together from various divergent views, various differences in the ways that they would have approached the work, different ways of thinking. And, we were really able to, there's the 4 C's, right, of crisis, response and preparedness: collaboration, coordination, cooperation, and collaboration. That really guided the response work. And I think when I think about public health and all the criticisms and all the challenges the sector continues to battle against, that is what motivates me, is that when we are together, when we share a purpose, and we realize the assets and the attributes, the skills and talents that we all bring to that table, there is power in that. There is strength in that. I think I, at some point, shared, my perspective to philanthropy, but it's also a perspective I share in the nonprofit sector and giving back: time, talent, treasure, ties, and testimony. We all have different assets, skills, attributes that we can bring to a table. And if we are able to identify what each individual is offering in that moment, along the trajectory, and continue to revisit that and ensure that people know why they're in this at the table, is part of this initiative, is part of this effort, and are able to, again, tie it together to our mission, our vision, and our values. To me, again, it's not going to happen overnight. And that's where the value of patience and trust come in, right? We have to remember why we are here and for what reason we are doing this. And with COVID, again, I'll use COVID as an example. One of the things that I think was just this guiding light was pulling examples from our history. And in public health and in SAPHA's history, we have so many examples of how this perspective, how this strategy, how this framework has led us to success, has allowed those solutions to be unearthed, delivered, and turn into policy and practice, right? And so, yeah, I mean, I think it's, most people coming in the work these days, again, in this next generation that's coming from, entrepreneurialism, innovation, and tech, they're used to answers right here, right now, tomorrow. And so I think there's a way that we can take that energy and that passion with the way that, traditionally in this work, it takes time. And we can really bring all of that together to one space so that we can balance out. But at the heart of it, right, is remembering the passion, the mission, the vision, and the values, and that goal that we're all working towards. That is, for me, what motivates me and what keeps me going. It's not easy, but we've seen what our coming together, our collective, our collaborative, our coordinated efforts can achieve.
Sharmila, this has been such an enlightening conversation, and I'm sure our listeners have so much to take away from this. So, in closing, what pearls of wisdom do you have for those who are aspiring to do, work in the South Asian public health area?
Oh gosh, words of wisdom. I don't associate myself with providing words of wisdom at all, because I gain so much from those of you that are doing this work every day in the field. And like I said, I am a lifelong learner. I'm very lucky to do work that allows me to live that every day. If there's a few things I'd say, I mean, I have always realized, right, how important, to truly affect change and see the impact of our efforts, we need to focus on root causes, addressing root causes and systems change, right? That's policy, that's the advocacy we talked about earlier. My earlier life, I focused a lot on direct service. I think that we need to realize the place for all of this work, to achieve the kind of impact that we're talking about, or have, that people want to achieve. We need all different types of people at the table that are addressing these issues that are so important to our community from various angles. And that's why SAPHA is so amazing, right? Like, I look at the membership and I'm like, I think, it's a one place where you bring together, like I was saying earlier, people have one objective and a goal, but they are approaching it from various avenues and lenses and disciplines. So a couple of things that I learned, and again, not pearls of wisdom because I'm still learning, but that what you pay attention to grows. So if you're going to focus on something, be intentional about it, put a plan in place, ensure that you are consistently moving in that direction, find the people that are going to help you get there, right? So that's that partnership, collaborative, trust, change moves at the speed of trust that I was saying. I think I said earlier that, there's never a failure, there's always a lesson. And that, I feel like if you trust the people, they will become the leaders that we seek. And so that's why, like, trust is such an important value to me. And the other thing is, that I've learned is change is constant, right? Like you tackle one issue, tomorrow there's going to be another one. There's going to be, I mean, we learned with COVID, right? Like it's constantly, it's still here, right? And so these are all principles of something that is called emergent strategy. This principle of emergent strategy comes from Adrienne Marie Brown. And I have been using this more in my work with boards of directors and with nonprofits and philanthropic leaders, because it has helped me personally in the work that I got to do in the last couple of years, but also helps me build confidence in those that I'm working with, future leaders, current leaders, emerging leaders, that they are in a place to really be the change they wish to see. Again, I know it sounds so cliche, but if we are not intentional and patient with ourselves and create space for this continuous learning, for the attention that something we're trying to achieve needs, where we won't find that success. And again, that principle of emergent strategy and the various sort of components of it, some of which I've just mentioned, really have helped me think differently about where I'm going and how quickly I can get there. And I just appreciate that perspective. So yeah, I mean, the last thing I'll say is just remember from where we've come, right? Celebrate our successes. SAPHA's great about doing that. I mean, I love when I see the convenings and you celebrate each other's work and talk about sort of what's left to be done. We have to pause and we have to take pride in those moments. And so I think that that's also really important. I think that I have found great, again, I said it earlier, but I'll impress upon it again, strengthen our numbers. And so I think when I think about SAPHA and this community, I think making sure that we continuously tap into that and recognize how incredibly valuable this community is, our community, and those just even beyond it.
Sharmila, thank you so much, for sharing such invaluable insights and, your experience with us today. It has been such an honor to have you as our guest for the SAPHA Spotlight series.
And to our listeners, thank you so much for joining us on this illuminating journey. Stay tuned for more conversations with past SAPHA board members and leaders in the field as we continue to explore the diverse narratives shaping the landscape of South Asian public health. Don't forget to follow us on YouTube and Spotify for updates, and consider supporting SAPHA's mission by visiting www.sapha.org. Until next time, this is Rubana
and Malini signing off.
Thank you all so much. This was incredible. It was really my pleasure. It was my pleasure. It was my honor to be with you. Thank you for the invitation to join you.